Joining us now, the founder, the president, the executive director, the CEO. He's got all the titles you could possibly imagine. Dale Bellis. He is the executive director of Liberty HealthShare, my HealthShare company that I've been with now for 3 years, and love it. Service has been fantastic. Dale, good to have you with us.
John, it is such a pleasure to be with you this morning. God bless you. It is so good to chat with you on the day after Independence Day.
I know. And see, I got out of the Obamacare rat race, so although I have to follow it and report on it, whatever they do has no impact on me. Dale, we've been with your company for 36 months now. Service has been phenomenal. Everything is great. And I just couldn't be happier because it's offered me freedom from health insurance, and I really now have health care, and it's exceeded my expectations in every possible way. Just so everybody knows, Liberty HealthShare is a HealthShare nonprofit. It's taken the nation by storm and bringing freedom back to the healthcare world. And check them out, 855-585-4237. Just ask for a free quote. It's going to knock your socks off. 855-585-4237, or go to libertyhealthshare.org and find out how simple it is. Dale, when I joined and Obamacare started, my premiums went from $500 a month to $1,000 for the same family of three. And my deductible under the insurance I had with Aetna went from $1,500 to $8,500. So basically, I was paying $1,000 to Obamacare, and I didn't have insurance. I had catastrophic insurance because I didn't have any care for anything. I mean, $8,500 I had to spend before I got a dime, so it didn't make any sense. So we just paid the fine, and they didn't have insurance. I mean, it's crazy, Dale. Crazy. Just paid the fine. And then Liberty HealthShare, my wife found it, and it's been fabulous because my share amount is like $525 a month, and the unshared that I have to pay before I get reimbursement, I think I'm saying it the right way, is $1,500 or $500 per person, and everything has been fabulous, and the service has been excellent. Now, tell us what you think about the Senate bill, and how do you think this is all going to play out?
Well, thank you, John, for that word of testimony. It's because we assert a simple principle. That is that we have a God-given right to manage and direct and control the care of our health. And that's precisely the missing element in this Senate discussion. They are perpetuating the myth that there is a combination of the idea of health insurance and health care. And conflating those two ideas is a terrible mistake. The national conversation doesn't need to be about the affordability of health insurance. It needs to be about the access and affordability of health care. Why are health care prices rising? Why is it difficult to gain access? Why is there such a massive overtreatment percentage where unnecessary care exists? How do we address the care of our health? The way we pay for the costs associated with caring for our health is a totally different discussion, and the conflation of those two ideas is a terrible mistake. That's number one.
Right.
And number two, because they're focused on health insurance, John, they are continuing the flaw in our national healthcare system, which is the third-party pay system. When somebody else pays the bill, it's not your money or mine, or our pockets are not impacted, and we don't have any skin in the game. When somebody else is paying the bill, an insurance company, the government, an employer, I really don't care about the costs. In fact, I'm isolated from the expenses because I never even see a bill. There is a way to change that system so that we all become healthcare consumers, but the third-party pay system is the basis for why we see skyrocketing costs in this arena.
So, look, there's no question the costs are out of control, and the third-party system is part of the issue, and I think you're onto something. Look, I've been a member of your organization for 36 months, and it's gone fabulous for us. Now, some people have mentioned a concern, and I want you to address it, Dale, which is one of your, I guess, competitors or companies in your field, MediShare, just got shut down by a judge saying that they didn't have enough reserves to cover the potential outstanding share cost out there. So he shut them down. They're in kind of the same business that you are. How is Liberty Share different? And do you have enough reserves? And how does this all affect your own company?
Well, if that's the case, and frankly, I'm not aware of that particular case. I'll check that out and find out the particulars on it. But we do confront this mentality between the difference between health insurance and health sharing. We're all self-pay patients, and we share the costs of our care with one another in a like-minded community that shares the same values and beliefs. And so the sufficiency of the member share amount to meet those costs is just a simple matter of that share amount rising or falling to the needs of the community as it presents itself. The reserves literally reside in the pockets of the members. So if we're sharing $500 a month, just as an easy number for families, and we see either a trend increasing or have a particular spike, we turn to the members and say, oh, by the way, to meet these costs, we need to add an additional $20. Those kinds of mechanisms exist with us, and the reserves reside with the members, not with a centralized company like an insurance arrangement or insurance model. And I'm sure if that is the case, MediShare will work through that discussion with the judge. But that's the difference between the two models. And it's just coming to grips with the fact that it's member-driven, member-decided, member participation that meets those costs month to month.
Okay, so I guess what I can't understand is why more people don't choose this way to engage with care, right? We have how many members you've got? You've got about 250,000 members. I don't know why it isn't 2.5 million or 5 million. Because from my vantage...
I'll tell you why. There's a couple of reasons. What you've just laid your finger on is one reason, in that folks just don't grasp the difference of the paradigm between health insurance and health sharing. So there's an education curve. That's number one. Number two is we all take responsibility, as you well know, for our individual care, the choices of our care. Mm-hmm. We simply choose to share those costs with others in the HealthShare community. And not everyone wants to take charge and responsibility for their care, John. It's a different mentality. And the third is it's about sharing and assisting others. It's not about receiving, it's about giving. And then that community's there for each of us whenever we have a bill. And so that mentality change is sometimes a threshold difficult to overcome.
I tell you what, though, once you get into it and you understand it, there's I don't really care what comes out of Obamacare or the new Senate bill. I mean, I hope it passes and they fix it for everybody else. But the freedom of once you get out of the whole thing and it doesn't matter. Now, look, obviously, if you're with a big company and you got Cadillac Insurance, or you're with the federal state government and the insurance is provided and you've got a $5 copay and everything is fine, that's fine. But if you're a small business owner like me, or you're an entrepreneur, or you work for a smaller company, or you're a contract worker, you're doing a 1099 and you don't have insurance available and you have to go out and try to buy it either on the Obamacare exchange, which are diminishing all over the place. In Nevada, for instance, there are no exchanges. Aetna's pulled out of Virginia. So your choices go down, which means your prices continue to go up. If you're forced to do that, you're crazy. I'm telling you, you're nuts. If you don't check out Liberty HealthShare, go to libertyhealthshare.org. It's not insurance, it's medical cost sharing. You don't pay a monthly fee, you pay a share amount. And all I can say, Dale, is my family's been on it for 3 years. The service is incredible. You know, when I first went to the doctor and I gave them the card, they're like, what is this? And I'm like, here's all you have to do. Call the number, all right? Somebody will answer the phone, and you'll get it all straightened out. And numerous times, Dale, the receptionist or the administrator, I'm still in the doctor's office, has come back to me and say, hey, call them up. I talked to them. Everything's done. And you put a lot of emphasis on preventative care. Like, for instance, I'm 59. I got my annual checkup, didn't cost me anything, blood tests, chest x-rays, got all that done. Then I got a colonoscopy, that paid for. I didn't pay anything. So I haven't paid anything except my share amount because that's viewed in your company as preventative. So I don't know why anybody wouldn't check this out, though.
Well, it just, as you've pointed out, it makes sense because we're all self-pay patients, and we're sharing our bills based upon our shared beliefs, one of them being that our bodies are created by God, and we have an obligation to take care of them, John. It's our temple. Mm-hmm. And so the preventative steps that we all engage in is just simply rises out of our shared values. And so we share those costs because it just makes sense, not only because it's a health prevention and cost prevention, but it's really what we ought to be doing. It's the right thing to do.
Plus, Dale, you can choose your own doctor. You can choose your own hospital. You can choose whatever you want. There's no restrictions. There's no network because it's like essentially when they get reimbursed, it's like paying cash. So you're out of all that. You're just out of the whole thing. I mean, it's like liberating, Dale. It really is.
Well, again, we assert that principle that we have a God-given right to direct the care of our own health. It's probably one of the most valued freedoms that we enjoy, and so that's why we've dropped out of the health insurance world and instead rely on one another in a voluntary, cooperative community of sharing those costs together.
Well, I tell you what, you guys are doing a fabulous job. Anybody out there that is just tired of the insurance rat race and you're getting hosed by Obamacare or you don't have insurance, check out Liberty HealthShare. You can call them 855-585-4237, 855-585-4237, or let your fingers do that walking. Go to libertyhealthshare.org, libertyhealthshare.org. Ask them for a quote. That's all you have to do. And when you get it back, here's what's going to happen. You're going to think it's a typo. You're going to think they forgot a zero. I'm telling you, libertyhealthshare.org is going to change the way you look at healthcare in America. Dale, thanks for being with us, man. Thanks for doing such a great job.
John. Thank you for the time this morning. God bless.
You guys are the best. This is the John Fredericks Radio Network. Go to libertyhealthshare.org. I'll be right back.